Welcome to the deep dive, where we take a whole stack of information and really try to get you well informed quickly. Today, we're diving into something, well, genuinely surprising and often devastating, actually. A hidden danger for horses, Ionophore toxicosis. Now, here's the really stark contrast that makes this so fascinating and frankly alarming. These compounds, they're widely and safely used. Everyday feed additives for other livestock, cattle, poultry.
Right. They're put in there to help with growth, prevent certain diseases.
Yeah.
Standard practice.
Standard practice for them, but for horses. They are a potent, often fatal poison. It's like one species' medicine is literally another's venom. It's quite shocking. So our mission today is to really unpack this silent killer. We want to explore what ionophores actually are, explain the exact ways, the insidious ways they wreak havoc inside a horse's body.
Yeah, how they cause that damage.
And detail how these accidental exposures typically happen. We'll also navigate the complexities of diagnosing such a, well, tricky condition.
It can be really hard to pin down.
And most crucially, discuss what can and sadly often cannot be done if exposure occurs. Ultimately, we really want to hammer home why prevention.
Well, it's just the absolute cornerstone here. Okay, so to understand this invisible threat, we really need to go microscopic, don't we? What exactly are these ionophores? How do they do this?
Well, at their core, they're a class of antibiotic. But don't let that term fool you into thinking they're like penicillin or something.
Right, not the same thing at all.
No, they're lipid-soluble, which basically means they're really good at slipping through a cell's outer fatty layer, the membrane.
Okay, so they can get inside easily?
Very easily. Think of them like tiny, unwanted couriers. They're designed specifically to grab certain ions, things like sodium, potassium, calcium, hydrogen, and just carry them right across those cell membranes where they shouldn't be going, or at least not in an uncontrolled way.
Like creating unauthorized tunnels into the cell? Exactly. That's a great way to put it. And what's truly fascinating here and, incredibly alarming is how these compounds, which are genuinely beneficial for cattle or poultry, become, well, a direct internal demolition crew for horses.
Demolition crew, wow.
Yeah. These ionophores completely interfere with a cell's ability to maintain that proper ion balance.
Yeah.
And that balance is absolutely crucial for, well, everything a cell does. Function correctly, producing energy. When ionophores get in, they cause this massive, uncontrolled flood of calcium ions into the cell, especially muscle cells. They're particularly susceptible.
Okay, too much calcium, what does that do?
Well, this calcium overload, it leads to profound mitochondrial damage and dysfunction. It essentially cripples the cell's energy factories. The mitochondria just can't keep up.
Cripples the power source.
Exactly. You also see hypercontraction of muscle fibers. The muscles basically seize up and ultimately cellular necrosis, which is just cell death. The cells literally die.
And are there specific ones we worry most about?
Yeah, there's several. But the main culprits, the ones we see most often, are marncin, that's by far the most common and extremely toxic to horses, lacilocid, which is also highly potent, and selinomycin. Those are the big three.
Okay, and here's where it gets really interesting and quite scary. Horses show this extreme, almost unique sensitivity to these things.
We really do. It's remarkable.
Let's compare this. The lethal dose, the LD50, that's the amount needed to be lethal to 50% of the animals, right?
Correct.
For monocin in horses, it can be incredibly low, like 2 to 3 milligrams per kilogram of body weight, just tiny amounts.
Tiny. Now, compare that to cattle. For them, the LD50 is more like 20 to 34 milligrams.
Okay, big difference already.
Huge. And then poultry, they can tolerate a staggering 90 to 200 milligrams.
Oh, 90 to 200 versus 2 to 3.
Yeah. It really drives home the point that for a horse, even the tiniest trace amount, something you wouldn't even think about for a chicken, can be deadly. It's a drastic difference in sensitivity.
So, with that extreme sensitivity burned into our minds, let's talk about where this attack hits hardest. Which parts of the horse's body really bear the brunt?
The primary targets are muscle tissues, specifically the cardiac muscle, the heart, and the skeletal muscles, the ones used for movement.
The heart. That sounds particularly bad.
It is. The heart muscle is exceptionally vulnerable, and there's a critical reason why. It has a really high density of those mitochondria, the energy factories we mentioned.
Right. Needs a lot of power.
Exactly. And it relies so heavily on extremely precise ion gradients to function properly, to beat rhythmically and strongly.
So throwing those gradients off is catastrophic.
Absolutely. When ionophores get into heart muscle cells, they cause myocardial necrosis. That's just death of heart muscle tissue.
Oh.
And that can lead to a whole cascade of terrible problems. Arrhythmias, those irregular heartbeats like tachycardia where the heart beats way too fast, or atrial fibrillation, which is just chaotic, uncoordinated beating.
Just ineffective beating, really.
Totally ineffective.
Yeah.
You also see decreased contractility. The heart's pumping ability just weakens significantly, and ultimately acute heart failure, which tragically often results in sudden, unexpected death.
Just found dead in the pasture or stall.
Sadly, yes. Think of it like this. The horse's heart is this incredibly finely tuned engine, right? Ionophores are like pouring the wrong corrosive fuel into it. They don't just clog it up. They actively destroy the engine's most critical parts from the inside out. And often there are no outward warning signs until it's far too late.
That's a devastating picture. So what does this mean for a horse that somehow survives that initial acute phase? Is the danger actually over then?
Unfortunately, no, not usually. If it always makes it through that initial crisis, the damage done to the heart is often irreversible.
Permanent damage.
Permanent damage. It can lead to chronic cardiomyopathy, that's a long-term heart muscle disease, or congestive heart failure down the road.
So what would that look like?
Well, it means they'll struggle significantly. Exercise intolerance is a big one. They just can't perform like they used to. And often, even if they seem okay for a while, maybe months, maybe even years, it can eventually lead to death from that progressive heart failure. And it's not just the heart, remember. Similar damage happens in skeletal muscles throughout the body.
Right, you mentioned that.
Yeah, leading to generalized weakness, ataxia, that's incoordination, stumbling, difficulty moving properly, and overall muscle stiffness. And while the heart and skeletal muscles are definitely the most prominent targets, we can sometimes see effects on the kidneys and even the nervous system too.
Wow. Okay, that raises a really critical question then.
Yeah.
Given how widespread this internal damage is, how do horses typically encounter this toxin? Because you said it's almost always an accident, right? They're not supposed to be eating this stuff.
Precisely. Ionophore toxicosis almost exclusively happens because of accidental ingestion. It's not like anyone's intentionally feeding it to horses.
So what are the common screw-ups, basically?
Well, the most common scenarios we see are, number one, feed mill mixing errors. This is a major concern. Horse feed gets unintentionally contaminated with ionophores during the manufacturing process at the mill.
How does that happen?
It could be residual dust in the machinery, improper sequencing of feed runs, maybe inadequate cleanup procedures between batches of medicated feed and non-medicated horse feed. Now, reputable feed mills work incredibly hard to prevent this. They have strict protocols, like using totally separate production lines for horse feed, or these really rigorous multi-stage cleaning procedures. But accidents can still happen.
Okay, so that's one way. Milk contamination. What else?
Number two, and this is probably just as common, if not more so on some farms, is access to medicated feed.
Ah, like getting into the cow feed.
Exactly. Often happens on mixed species farms. Horses somehow get access to feed meant for cattle or poultry or other species that do legally and safely contain ionophores for those animals. If feed isn't stored securely or feeding areas aren't strictly separated, the risk is incredibly high. A broken fence, a gate left open, spilled feed.
Simple mistakes with huge consequences.
Huge. And then lastly, though it's less common, we sometimes see contaminated pasture or water sources. Maybe a bag of medicated feed gets spilled in a pasture and not cleaned up properly, or maybe runoff from a cattle feeding area contaminates a water source horses use. Less likely, but possible.
Right. Okay, so now we know how it happens, but spotting it, that sounds really challenging. You said the signs aren't always obvious and the toxin disappears quickly.
That's right. Diagnosis can be incredibly tough. The clinical signs are often non-specific, meaning they could look like a lot of other problems like colic or tying up or neurological issues. And the ionophores themselves are metabolized and cleared from the body relatively quickly. So testing the horse's blood for the toxin itself is usually not helpful unless you catch it extremely early.
So vets really need to have it on their radar.
Absolutely. A strong index of suspicion is crucial, especially if you see multiple horses affected around the same time or if there are unexplained cases of sudden death on a farm. That should immediately raise a red flag.
Okay, so what are the signs, even if they're non-specific? Does it vary?
It definitely varies, mostly depending on the dose the horse ingested.
Yeah.
That dictates how quickly and severely the symptoms show up.
Makes sense.
So in acute high-dose exposure, this usually shows up within hours, maybe up to a couple of days. Sudden death is often the first, and sometimes, tragically, the only sign. The horse might just be found dead with no prior warning.
That's terrifying.
It is. Other acute signs can include severe colic-like symptoms, profound weakness, we're talking ataxia,
Mhm.
muscle tremors, profuse sweating, sometimes inability to even stand up. You'll see clear cardiovascular signs like a really rapid or irregular heartbeat, maybe signs of shock or cardiovascular collapse, respiratory distress,
Yeah.
difficulty breathing, and usually complete anorexia. They just won't eat.
Okay, that's the acute high-dose picture. What about lower doses over time?
Right? The chronic low-dose exposure. This could be much more insidious, manifesting over days, weeks, sometimes even months. The signs are often subtle at first. Things like poor performance, maybe the horse just isn't working at its usual level. Exercise intolerance gets tired much more easily. Progressive weakness and ataxia that kind of creeps up. Unexplained weight loss.
Things you might blame on something else initially.
Exactly.
Yeah.
Until eventually you might start seeing signs of congestive heart failure developing, like edema or swelling in the limbs or jugular distension where the big veins in the neck look visibly swollen because the heart isn't pumping efficiently anymore.
So when a veterinarian suspects this might be going on, what's the absolute first step? I imagine getting the full story, the history, is critical here, isn't it?
Absolutely vital. The first and probably most important step is taking a thorough history. You need to ask really specific questions. Any recent feed changes? Any possibility at all the horse could have gotten into feed meant for other animals? Are there other livestock like cattle or chickens on the property? Where did the current feed come from? Was it from a reliable source?
And you mentioned multiple horses being affected.
Yes, that's a huge clue. If multiple horses eating the same feed suddenly become ill or die, Ionophore toxicosis jumps way up the list of possibilities.
Okay, history first. Then what? Lab tests.
Yes, laboratory diagnostics are key. We look for markedly elevated serum muscle enzymes, things like creatine kinase CK or CPK-NAST. These enzymes basically leak out of damaged muscle cells into the bloodstream, so high levels indicate muscle injury.
Okay, general muscle damage markers.
Right. But even more importantly, we look for elevated cardiac troponin I, or CTNI. This is a protein that's very specific to heart muscle cells. When the heart muscle is damaged, CTNI leaks into the blood. It's a very sensitive and specific biomarker for heart muscle injury, so it's highly indicative of ionophore toxicity. And rising levels can also help us assess the severity and prognosis.
That sounds like a really crucial test.
It is. You might also see myoglobinuria, that's myoglobin from damaged muscle spilling into the urine, making it look dark red or brown.
And imaging. Can you see the damage?
Sometimes. Diagnostic imaging, like an electrocardiogram and ECG, is important to identify those arrhythmias, the irregular heartbeats.
Mm-hmm.
And an echocardiogram, which is an ultrasound of the heart, is really valuable. It lets us actually look at the heart chambers, assess how well the muscle is contracting, measure the wall thickness, and look for visible evidence of myocardial damage or dysfunction.
Okay. And if the horse unfortunately dies?
Then a post-mortem examination, a necropsy, is invaluable for getting a definitive diagnosis. Grossly, you might see characteristic pale areas, streaks, or obvious signs of degeneration in the heart muscle and sometimes skeletal muscles. Microscopically, the pathologist will look for specific changes like cell death, inflammation, and sometimes even calcium deposits within the damaged muscle cells.
But the absolute confirmation comes from the feed itself.
Yes, the single most definitive way to confirm exposure is feed analysis. Testing the suspect feed, or even stomach contents if available, for the presence and quantity of ionophores like monensin. It's absolutely critical if you suspect a feed issue to immediately collect a representative sample. Don't just grab a handful. Take at least a gallon-sized Ziploc bag full, maybe from different parts of the bag or bin, label it carefully, and freeze it right away. Freezing helps preserve the sample until it can be sent to a specialized lab for analysis.
Freeze it. Got it. Okay, so with all that diagnostic effort, what can actually be done for a horse that's diagnosed with ionophore poisoning? Is there like an antidote, a magic bullet?
Unfortunately, no. That's the grim reality. There is no specific antidote for ionophore poisoning. None.
Oh, wow. So treatment is just supportive.
Entirely supportive.
Yeah.
And often, sadly, unrewarding, especially in those acute, severe cases where the damage is massive and happens fast.
So what are the immediate actions?
First, immediately stop feeding all suspected contaminated feed to every horse on the property. Don't wait for test results. Secure that feed so no other animals can get to it and save it for testing. Isolate the affected horses, keep them quiet, and contact a veterinarian immediately. Time is absolutely critical.
Is there anything to do to, like, stop absorption?
If, and it's a big if, the ingestion was very recent, maybe within the first 12, perhaps 24 hours, those sooner is better decontamination methods might help a little. Giving oral activated charcoal, sometimes mineral oil, can potentially help bind any remaining toxin in the gastrointestinal tract and prevent further absorption. But often, by the time signs appear, significant absorption has already occurred.
Right. So mostly you're dealing with the damage that's already done. This sounds like a long, intensive road for both the horse and the owner then. What does that supportive care actually look like? Here's where the commitment of care truly comes into play.
It absolutely is. Supportive and symptomatic care is intense and prolonged. The most crucial element is strict stall rest. Absolutely strict. For months, potentially even up to a year in some
A
cases.
year? Wow, why so long?
To minimize absolutely any workload on the damaged heart. Any exertion increases the heart's oxygen demand and strain, which can worsen the damage or even precipitate fatal heart failure or arrhythmia in a compromised heart.
Okay, strict rest. What else?
Intravenous fluids might be used carefully for hydration and circulatory support, but you have to be extremely cautious if heart failure is already present, because overloading them with fluids can make things worse.
Right, tricky balance.
Very. Anti-inflammatory drugs like flunixin, meglumine, banamine might be used to help manage muscle pain and inflammation. And sometimes antioxidants like vitamin E and selenium are given, the idea being they might help mitigate ongoing oxidative damage in the muscles, but the evidence for their effectiveness, specifically in ionophore toxicity, is limited.
And what about targeting the heart problems directly, like the arrhythmias?
For severe arrhythmias, certain antiarrhythmic drugs might be attempted, things like lidocaine or quinidine, depending on the type of arrhythmia. But, and this is important to be realistic about, these interventions are rarely truly effective when there's massive death of the heart muscle tissue itself. You can't make dead tissue conduct electricity properly again.
So you're just managing symptoms, not fixing the core problem.
Pretty much.
Right.
And it's also vital to know there are drugs you absolutely must avoid. For example, digoxin, a drug sometimes used for heart failure, is strongly contraindicated in ionophore poisoning because it can actually increase calcium influx into cells and worsen the cell death. So using the wrong drug can literally do more harm than good.
Wow, okay. So putting it all together, what does this really mean for the horse's chances? The prognosis.
Honestly, the prognosis is generally considered poor to grave, meaning very unlikely to recover fully, especially with significant exposure. It's highly dependent on the specific ionophore, the dose ingested, and crucially, the extent and severity of the cardiac damage.
So worse heart damage means worse outlook.
Exactly. Acute high-dose exposure, as we said, often just results in sudden death before any intervention is even possible. Horses that do survive that initial critical phase, well, they frequently develop severe, irreversible heart damage.
No going back from that.
No. Complete recovery back to full athletic function is rare. Very rare. Even survivors often have permanent heart damage, that chronic cardiomyopathy we talked about. They might look relatively normal just standing in a field, but they'll likely be exercise intolerant. They just won't have the stamina. And they remain at significant risk for sudden cardiac death later on, or progression to chronic congestive heart failure.
So no more jumping, no more racing.
Absolutely not. It's a hard truth. But horses with significant cardiac lesions documented after ionophore toxicosis should never be used for strenuous athletic purposes again. The risk is just too high.
Which really brings us back full circle, doesn't it? If treatment is so limited and the outcome often so poor,
Then prevention is everything.
Yeah.
If we connect this to the bigger picture, given the lack of an antidote, the difficulty in treatment, and the often grim prognosis, prevention truly becomes the single most important defense we have.
that's right. Preventing ionophore exposure is the absolute cornerstone. It has to be the top priority for every single horse owner, every barn manager, anyone involved with horses where other livestock might also be present. There's just no getting around it.
It truly cannot be overstated. And the good news is, prevention is achievable with diligence. Here are the key actionable strategies. First, feed quality control. This is huge. Always, always purchase feed from reputable manufacturers who have and can demonstrate strict quality control measures specifically designed to prevent cross-contamination. Ask your feed supplier about their protocols. Some mills even market themselves as ionophore-free facilities, which offers an extra layer of security.
Okay, choose your supplier carefully. What else?
Second, label reading. Become obsessive about it. Diligently read every single feed tag or label every time, without exception. Ensure no ionophores look for names like melansin, rumicin, lossalocid, bovatex, selenomycin, nericin are listed. Be especially careful with bulk feeds or any feed that doesn't come clearly labeled. A quick glance isn't enough. Read the fine print.
Don't assume. Check every time.
Every single time. Third, separate storage and feeding. This is non-negotiable on mixed farms. You must strictly separate horse feed from any feed containing ionophores intended for other species, physically separate storage areas. Make absolutely sure horses cannot access feed bins, troughs, or spilled feed meant for cattle, poultry, goats, whatever. Use separate scoops, separate buckets, no sharing. Secure feed rooms are essential.
Physical barriers. Got it.
Fourth, communication. If you have both horses and other livestock receiving ionophore medicated feed on the same property, make sure everyone working there are family members, employees, boarders, is fully aware of the extreme danger ionophores pose to horses. Train them on the importance of strict biosecurity, proper feed handling, and never ever mixing feeds or equipment.
Everyone needs to be on the same page.
Everyone. And finally, record keeping. It's a simple thing, but keep your feed labels. Keep track of the brand, the specific product name, and especially the lot number for any feed you purchase. If a problem ever does arise, having that information is absolutely invaluable for tracing the source quickly and alerting the manufacturer and potentially other horse owners.
Excellent practical advice. So wrapping this up, the critical take-home message today seems crystal clear. Ionophores pose this unique, devastating, and often silent threat specifically to horses. The damage happens internally, diagnosis is tough, treatment is limited.
Which means diligent, proactive prevention is paramount. It's not just important, it's everything.
It really is.
And maybe a final thought to leave you with. Consider not just the immediate risk to your own animals, but the ripple effect this knowledge has. Think about responsible farm management overall, and maybe even advocating for clearer labeling or stronger feed safety standards in the industry. What steps could you personally take to make sure this critical information reaches others in your horse community, people who might still be unaware of this hidden but preventable danger?
A really important question to ponder. Thank you for joining us for this crucial deep dive today. We genuinely hope you feel truly well-informed and empowered to protect the horses in your care.